Are you turning 65, or are you on Medicare and you're getting sick and tired, or you're beyond sick and tired of all the clutter in the mail, all the unsolicited phone calls, the TV ads promising you the moon and back? Stay tuned. We have some information you're not going to want to miss. Hey everyone, this is Rick MacDermid here with Senior Solutions Group. And we are in the midst of the annual Medicare open enrollment season, which started on Monday of this week and will go through Pearl Harbor Day, December 7th. So if you haven't subscribed to our YouTube channel yet, feel free to do so. And we are going to get rolling here. So just yesterday, October 19th, CMS, the Center for Medicare and Medicaid Services, released a memo, and it is addressed from Catherine A. Coleman, the director. And the subject is CMS monitoring activities and best practices during the annual election period. So the Center for Medicare and Medicaid Services, CMS, which runs Medicare, they put out this booklet here, the Medicare and You book, which comes out every year. They issued this memorandum informing Medicare Advantage organizations, insurance companies, and Part D sponsors, also insurance companies, of CMS's monitoring activities and sharing plan and sponsor best practices during the 2023 annual election period, known as AEP in the insurance world, running from October 15th of 2022 through December 7th of 2023. By the way, these ads, they don't stop, they go year-round. So CMS is concerned about the marketing practices of all entities, including third-party marketing organizations, those Joe Namath ads, those celebrities that talk about Medicare Advantage almost exclusively. And they have reviewed thousands of complaints and hundreds of audio calls and have identified numerous issues with information provided to beneficiaries that is confusing, misleading, and or inaccurate. CMS Medicare has conducted so-called secret shopping. That would be a fun job, I think, to be a secret shopper, by calling numbers associated with television advertisements. As a matter of fact, you could probably be a secret shopper yourself if you wanted to take an hour out of your day to do so by calling one of these numbers. Mailings, newspaper advertisements, and internet searches to monitor the experience beneficiaries have engaging these entities. Our secret shopping activities have discovered that some agents, probably a lot of agents, hundreds of agents, maybe thousands of agents, were not complying with current regulation and unduly pressuring beneficiaries, as well as failing to provide accurate or enough information to assist a beneficiary in making an informed enrollment decision. So just October 1st, 3 weeks ago, we are now required by government mandate to record all of our phone calls that we talk to our current clients about their Medicare options moving forward. Now, if we have an in-office appointment, obviously we don't have to record those appointments. But any appointments or phone calls that we talk about Medicare plan options, we're required to read a disclaimer and tell them that this call is recorded per Medicare regulations and go through a little disclaimer. In large part, because of these big, giant third-party organizations like the Joe Namath ads, those types of entities, these third-party marketing organizations. Now, so this letter kind of makes it clear that they're really honing in on those organizations, not the small agencies like us that are here to help people and are, for the most part, doing a good job in helping people. So CMS reminds Medicare Advantage organizations, so Medicare Advantage are the companies that offer health insurance for people on Medicare, where they basically take over the bus. Medicare hops off the bus, they are no longer the driver, they hand the keys of the bus to the insurance company, and the insurance company drives the bus instead of Medicare, not a supplement. It's a replacement to Medicare. So these organizations, these insurance companies, and Part D sponsors that are responsible for the marketing activities of the agents and brokers and other third-party entities with whom they contract. CMS is closely monitoring marketing activities during the 2023 open enrollment, including marketing that is misleading, confusing, or misrepresents a benefit or product that will take compliance action against plans for activities and materials that do not comply with CMS requirements. About a year ago, we put together a video from another memo from CMS that they put out about these third-party organizations that we're going to be watching you. And then lo and behold, several months later, they inform us that now we're going to be required to record all of our phone calls. So these third-party entities that CMS is focusing on is requiring these, like these television ads, requires these TV ads to file for use, and CMS is reminding these organizations that they may review television advertisements promoting Medicare Advantage health plans during a 5-day file and wait time consistent with our longstanding authority. I don't know of any other TV ad that has to go through this scrutiny. Maybe there are, but I'm not aware of it. It's obviously a big issue. We know that's a big issue. CMS is particularly concerned with recent national television advertisements promoting Medicare plan benefits, those commercials, and cost savings, which may only be available in limited services areas. So if you call, we'll look up your zip code. Often these telemarketers will look up your zip code for the very first time in their life. It looks like you live in Yakima. Well, it's Yakima, not Yakima. And these are the plans that are in your area. They'll overstate available benefits as well as use words and imagery that may confuse beneficiaries or cause them to believe the advertisement is coming directly from the government. So you watch one of these ads and you say, well, I can get dental, I can get vision, I can get hearing, all this free stuff added to my Medicare. Well, no, that's not how it works. You're actually replacing your Medicare with an insurance company. Medicare's hopping off the bus and handing the keys of the bus to the insurance company who drives down the road, and Medicare waves goodbye. So due to these concerns, beginning January 1st of 2023, no television advertisements will qualify for submission under file and use authority. That's very interesting. Additionally, CMS will continue to review all previously submitted television advertisements to confirm the materials meet CMS requirements. Television advertisements found to be out of compliance with applicable requirements must be discontinued. Wonderful, start seeing less ads. Plans that continue to use CMS disapproved advertisements may be subject to compliance action. And it also goes into talk about more reviews that are required, marketing materials, mail pieces. I called Medicare a week ago for a client of ours who was in the hospital, had a major accident, broke a bunch of bones, was in the hospital for many days, got transferred to a skilled nursing facility. She was on regular Medicare with a supplement to Medicare. So in this case, Medicare is the bus driver. The insurance company is just along for the ride. They're not driving the bus. So whatever Medicare pays, the insurance company must pay by law. Kind of boring, no bells and whistles, but she sleeps well at night knowing that her plan is going to cover her no matter what, as long as Medicare pays their part. Turns out she got a bill for $1,484, which in 2021 was the Medicare Part A deductible for hospital stay. Well, it was for a skilled nursing facility. So we were calling Medicare trying to figure out what's going on. We found out that the facility had already been paid and it looked like they were double dipping. But it turns out that they weren't double dipping. She was transferred to another facility. So they got mixed up. I was filing a complaint against the facility, a Medicare complaint. So you can call 1-800-Medicare. And in this article, we'll have a link to this article, shows how you can call 1-800-Medicare to file a complaint. When I called 1-800-Medicare saying I want to file a complaint with my client on the line, they assumed that I was complaining about an agent immediately. say, oh, you want to file a complaint against an agent? No, I am the agent. They were taken aback. It's like, what? All of our complaints are basically about agents and nothing but agents. So, no, I'm calling about this facility. Our client has Medicare and a supplement. She should not have to pay this. So that kind of threw them from a loop. They did a bunch of research. They said, no, you got to follow up with the facility. So we were unable to file the complaint. But that, needless to say, these Medicare agents that answer the phone are so used to getting complaints about agents that they automatically assumed that I was calling about a facility and I was actually an agent. So it kind of gave me a little bit of a behind the scenes experience. I called the facility. We worked it out. I called the insurance company, was on the phone for another probably hour or so figuring this out for our clients. By the way, when we sign up a client, our work just begins. It does not end. So me spending an hour and a half or so on the phone helping our client, not only today, but in years past, we have forged a relationship. She relies on us. She relies on me to help her. If you were to call an 800 number, I can't tell you what's going to happen. But all I can tell you is that we are wanting to help our clients not only find the best plan, but as your needs change, if you have crises in life that you need help with, that's why we do what we do. We've never received a complaint. We don't intend on receiving a complaint. We're going to do things the right way, by hook or by crook. We will never, ever give you an answer that we don't know is truthful. If we don't know the answer, we're going to find out what that answer is. The bottom line is, you need to be very careful with who you talk to. Everyone's claiming that they're an expert. They may have just received their insurance license. They're working for a call center that is trying to add 10,000 people per year to their commission rolls in order to sell their company to a bigger company, which may sell your book of business that you're on to another bigger company. If that's your cup of tea, that's great. But if you're looking for someone that is a mom and pop looking out for your best interest, you don't have an agent, you want someone that's going to take care of you, we are here for you at Senior Solutions Group. Feel free to reach out to us. We're here for you. We love helping people, even if it's just one question that you just need answered. You do not have to become a client. We never charge a fee. We are here for you. Thanks for taking the time to check out this video. Please share it with a friend. It's very important that people don't get taken advantage of and they get the right information. We are here to help save you money without reducing your benefits, to help you keep your doctor, and we are here for you. Thank you so much.